assessment station is a 15-minute station, and it's the only station where you will meet a real live patient, unlike the other stations where you meet either a mannequin or it's a silent written station. Here you're being tested on a set of skills, including observation for safety, observation of what's around the patient, good communication, and correct and accurate documentation. Use the SHIP IELTS introduction that's covered in the course, and also make sure that you do a safe introduction to the patient and approach, which is all explained in there. You must explain the purpose of your visit, ensuring that the patient understands exactly why they are in hospital. Always verbalise maintaining privacy and dignity, shutting curtains and doors, and you should also address their comfort. If they say they're in pain or discomfort in any way, offer repositioning. Remember, a respiratory patient should always be nursed upright anyway, and also ask if they require analgesia or if they've already had it, just to mention that it probably might start working soon. Do gain consent for the procedure that you're about to do. Explain it will take 15 minutes. If they wanted to go to the toilet first, now might be a good time. And when you do take the full set of OBS, ensure that you've asked appropriate questions and give them instructions, and also perform them as per Royal Marsden. Document them as you do them and ensure that all the scores are correct, adding up the new score at the end. Explain the significance of this to the patient and also asking them if they normally have a variance in any of the parameters like their blood pressure or pulse normally. Make sure you sign at the end of the form and also verbalise clearly what you will do with that information, and if required that you'll escalate it to a doctor and mention it to the nurse in charge. Also advise when you will next check their OBS, but also reassure the patient if this is quite frequently. You will have a lot of information about the patient that you've already gleaned from the assessment booklet, and you will have also already read a scenario about them just as you've met them. So you'll know quite a lot of information already, but do discuss activities of daily living with the patient, their social situation, and see if any thing needs to be put in place or if they do have any other concerns. Take cues from the props that are around the patient on their bedside table, such as glasses, hearing aids. If you see lighter and cigarettes, obviously you need to address this, and smoking cessation, and also you need to lock the lighter away. Unhealthy stacks are there for a reason. They want you to talk about diet and healthy lifestyle choices. Do offer leaflets or referrals where appropriate. Ensure that you are using your best communication skills in the OSCE. Good rapport is being assessed. Focusing on the tone of your voice, open body language, and conveying empathy, compassion to the patient. Use active listening skills to address their concerns, repeating back to them any areas of concern for clarification. Check your paperwork before the 15 minutes is up. It's all accurate, all the details are filled in, and do leave the patient correctly with the buzzer, and always decontaminate your hands at the end of the scenario.